A little bit about what is heart failure. According to the American Heart Association, heart failure is a chronic progressive condition in which the heart muscle is unable to pump enough blood through the heart to meet the body's need for blood and oxygen. So I'm going to talk a little bit about signs and symptoms of heart failure. So some of the symptoms of heart failure are shortness of breath during activity and at rest, persistent coughing or wheezing, a buildup of fluid, or also called edema, in the feet, ankles, legs, or abdomen, tiredness, fatigue with activities, decreased appetite, and in the late stages of heart failure, some people become confused or have memory loss. Also, I just want to discuss how do clinicians treat heart failure. Lifestyle changes such as quitting smoking, managing stress, losing weight is important to treat heart failure. Daily exercise as well as getting adequate rest, eating a low-fat, low-sodium diet, tracking daily weight, avoiding alcohol, and limiting your fluid intake to 1,500 ml or 1.5 liters a day. Patients can benefit from joining a support group. There's medications to treat heart failure. And the only cure for heart failure is heart transplantation. There's no cure for heart failure. Just want to discuss some facts about heart failure and how it affects patients with heart failure. Congestive heart failure is a very complex, chronic, debilitating illness that affects approximately 5.3 million Americans. Heart failure accounts for a total of 1.1 million hospitalizations a year, so you see it really does impact our healthcare industry. Treating heart failure results in nearly $3.4 billion in annual healthcare costs. It costs a lot to treat heart failure patients. Every year, 550,000 new patients are diagnosed with heart failure. So you can see every year we have new patients to treat. This is a big factor, and this is why we need to cut the readmission rate of heart failure. Patients non-compliant from following a low-sodium diet, maintaining fluid restriction, monitoring their daily weight, and not following their medications being often lead to many heart failure patients being readmitted to the hospital. 27% of all patients are readmitted within 30 days of leaving the hospital. And that's a large number. We need to cut that down. Heart failure patients' readmissions cost Medicare $18 billion per year and are the most frequent reasons for rehospitalization. Why do nurses play an important role in reducing readmission rates in heart failure patients? Now more than ever, the role of nursing will play a vital role in reducing complications and readmission rates of patients with heart failure. According to the Center for Medicare and Medicaid Services, they've identified readmission rates for patients with heart failure being measured in hospitals with the highest readmission rates will have reduced reimbursement to 1% this year, 2% in 2014, and then ultimately cap to 3% in 2015. So you can see it's really important for hospitals and clinicians to decrease the heart failure rates. Savings with preventing hospital readmission rates of heart failure patients receiving Medicare is projected to be $7.1 billion over 10 years. Hospitals recognizing the need to decrease heart failure readmission rates will develop a heart failure disease management program. Development of a nurse heart failure transition coordinator role to assist patients transition from the acute care setting to the home care setting. A heart failure nurse will identify all heart failure patients admitted to the hospital. Heart failure nurse will meet with each patient during their admission to discuss the program and its goals, taking a multidisciplinary approach, assessing their lifestyle, and taking discussing and understanding the patient's heart failure process. The heart failure nurse will educate heart failure patients immediately on the importance of a low-sodium diet, maintaining a fluid restriction, daily weight, and the signs and symptoms of worsening heart failure. Anybody in the group have any questions?
I do.
Sure.
The part that talked about the caps.
Right.
Does that mean the hospitals are going to be losing money because
Yeah.
they're going to put a cap on it? So it would be in your best interest to make sure that their patients are not readmitted.
Exactly.
Right?
Under the new healthcare law in 2010, also known as Obamacare, that's what President Obama wants to put in there because hospitals were inefficient in caring for heart failure patients.
Okay,
as you can see, a quarter of the patients were coming back within 30 days.
Yeah.
So what we need to do is look at better ways to treat these patients, and one of the ways is having a nurse follow these patients while they're in the hospital and follow them while they're at home.
So hard to test them, like when once they get home, to stay in touch to make sure they're taking their meds and continue with their low sodium diet and things like that.
Exactly.
Okay, so hospitals are going to be losing money if these patients continue to return every 30 days.
You're talking billions of dollars.
Oh my goodness.
Billions of dollars. And it's an incentive for them to develop programs like this. And that's where all nurses come in.
Yeah, so nobody wants to lose money because the staff has to be paid, you know?
Exactly. Yep.
Wow.
Any more questions? Once the patients are discharged from the hospital, the heart failure nurse plays an important role by following up with patients by phone consultation and arranging with visiting heart failure home care nursing, post-discharge follow-up, and that's what we were just discussing. The heart failure nurse will also make and confirm any appointments the patient may have upon discharge, continuing to educate the patient post-admission is imperative for reinforcing the heart failure process, and that's what we were kind of just talking about, is having those patients educated on what they need to do. And then finally, in clinical trials sponsored by the National Institutes of Health, heart failure readmission rate within 6 weeks was reduced by 57%. So that's pretty significant. I mean, we decreased that almost over half. Within 6 months, it was reduced 50% using a heart failure nurse. So you can see the role of the nurse is very vital to decreasing the readmission rate.
So there would just be nurses specifically that work with heart failure?
Yes. Yes. And in the institution that I work at, that's what we've done.
Because I come from the social services world, and in our world we do follow up with clients even after they left the program for 6 months up to a year.
Right.
And it's like case management work. It's a lot of work, but
it's the same process. In the past, we just discharged these patients at home, and there was no follow-up. And now, because of the new law, you know, in the ACA 2010 law, this is forcing hospitals to follow through with their patients, and it's proven to work. 6 and 12-month costs associated with readmission rates were reduced by 58% and 39% respectively when using a heart failure nurse. So we're talking billions of dollars.
a lot of money.
Heart failure is a complex and difficult disease for patients to manage on their own. And through education post-monitoring, heart failure patients, through monitoring, heart failure patients the heart failure nurse plays an important role in improving the quality of life and reducing the readmission rates of heart failure patients, which will ultimately reduce healthcare costs. At all levels of care, nurses will drive public policy, disease prevention, and healthcare promotion. Finally, the nurse's role as caregiver continues to evolve to include the role of nurse navigator, disease manager, and educator. Any questions?
Definitely educator.
Thank you.
People about the illnesses.
Yes. Thank you, guys. Thank you.
Very good, David.